So one of the things that we hear pretty frequently is someone says, well, I have to get a test for work. What is that? And then there is the situation where someone has been exposed to someone who has potentially has COVID, and they go for a test, and they may get a negative that's later called a false positive. Just kind of asking you from the perspective of a nurse in the health department, how should we better understand that?
Okay, so with the antigen test or a PCR test, that's just to let you know that you currently have an infection. You may currently have the infection. So we do that test at the Joseph Walker Williams. And then also I know DPSCD has testing on site. So just depending on the test that they're offering, you can get that information as far as a negative or a positive test. However, if we're looking at the antibody test, that is to let us know how much antibodies you do have in your system. So, and it also depends on when you get that test. So if you have been vaccinated, and you are experiencing symptoms, the CDC is recommending that you wait and get your test at least 3 to 5 days after you've been exposed to COVID-19. So timing is very important when you get the test, because after you've been exposed, it will take some time for that exposure to come up in your blood work.
That's really important. So there is a recommendation if you've been vaccinated and you know you've been exposed to someone with COVID to wait how many days?
3 to 5 days. 3
to 5 days to, in fact, not only to see if there's symptoms, but to go and get tested.
Yes.
If you are unvaccinated and you discover that you have been exposed to someone with COVID, what is the recommendation?
So if you are unvaccinated, you should wait about, those symptoms should come in 2 to 14 days. So once those symptoms appear, you should get tested.
So here's the question, and this really has to do with the issue around spread. So if I've been exposed to someone or someone's that I know have COVID, should I, while I may be deferring getting testing because we're waiting for symptoms to emerge, but should I be quarantining at this point?
Oh, absolutely. And that's to protect yourself and then to protect others around you. You should, yes, immediately quarantine at home. And if you're at home and you share that home with others, try to quarantine in a room separate from others, and then don't share like utensils or personal products or anything like that.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.